The challenges that we face with the opioid epidemic, it's very, very widespreading to families and to the judicial system and to children. It's huge. It's absolutely huge. Beyond the politicizing today and all the media focus around this storm, everyone has been touched by someone that's been lost in a cycle of addiction.
It's here, just like it is everywhere else. The epidemic's here, people are using here, drugs are here, the fentanyl's here, everything's here that's really turned this into a really bad situation.
The storm brewing right now in our nation with the opioid crisis and epidemic is clear, and healthcare is right in the eye of the storm.
There were days where I could not get out of bed if I did not take prescription pain medicine. It had a total grip on my life. That means lying to doctors, stealing people's pain medicine. That meant taking cash out of houses. In my mind, it was a life or death. If I did not have the pills, I was literally going to die.
Almost every shift, somebody comes in with some type of substance abuse problem. You can only do this for so long until you realize that we could possibly be doing more harm than good with all the narcotics that we were prescribing.
It really impacts the families, the caregivers, the children, our community once they leave the four walls of our hospital. And we have a great responsibility as the hospital to be a server of hope and to do this differently and have conversations that haven't been had before.
We really need to approach this problem differently.
Our team sat down and we had a really honest conversation about our opportunity to impact human life.
We created a formal structure of our multi-faceted executive teams, bringing all the stakeholders together, both internal and external, to focus on this work.
We just decided the first thing we were going to do was not make it worse. Right? We've got a reduction approach in terms of if they need narcotics in the emergency department, we're going to give the lowest amount that they need, the lowest dose and then lowest number of pills. It was surprising to see our patients are not complaining that their pain is not well controlled, and we're doing 50% less than what we were doing before. In addition to that, don't give drugs or narcotics, controlled substances anymore to people who are already addicted to them.
If we treat medically a patient that has an addiction and we discharge the patient home and they're still an addict, they're going to go home and continue in their cycle of addiction. They're going to destroy families.
I think most addicts think, I'm only hurting myself. I'd never looked in the mirror because I never liked the person that I saw. But then I had to think about, well, what does my family see? Not just my wife and children, but my parents, my brothers and sisters, my grandparents. I just wanted someone to say, hey, David, I care about you, and I want to see you get help. I want to see you thrive.
We weren't having conversations around substance abuse, and we wanted to create a process that gives the patient and the families an opportunity to have that same face-to-face conversation the same way you would with your cardiologist or your orthopedic doctor.
We figured out a way to create an automatic consult for a substance abuse patient. So the physician, whoever they may be, hospital medicine doctor or cardiologist or orthopedist, if they notice a patient who is a narcotic addict, they'll click that consult, and the whole process will go in place from there.
People are seeking care with us when they are at their most vulnerable time. And so why wouldn't we capture that opportunity to plant a seed of hope? So it was critical for us to reach out and engage several stakeholders at the community level. That was a lot of critical conversations, a lot of vetting of quality and outcomes on their part and ours to ensure we were going to build the right process for our patients.
We're a dual diagnosis substance abuse and mental health treatment center. Basically what that is I help connect patients and their family to the right treatment options. What TriStar Horizon Medical Center is doing is something I haven't, within my profession, seen done. When patients come into the hospital with them, they're not leaving that hospital without knowing what their options are. We're not giving them a sheet of paper expecting them to make phone calls and setting this up for themselves. We're putting a person in front of them, and we're sticking with them whether they're in the hospital or once they leave, whether they decide to go to treatment then or not.
If you said no to the conversation, there will still be follow-up. If you said yes to the conversation, we have pieces of the process built in that it could be a 3-month follow-up or even follow you for at least 12 months. The amount of patients we have placed into treatment in just a short time has proven to us that having a face-to-face conversation at the bedside is the most important part of this whole story.
92% of the patients we put the consult in accepted the conversation. And then we've had a significant percentage who have not only accepted the consult but gone into treatment.
Being able to have that open dialogue, that open conversation with a physician right then and there, that's the first step in all of this. I think they're in a safe environment. It's a big thing for an addict to feel safe. And I think Horizon has created that.
One by one, that the stigma of this population began to erode, but based on how our team connected personally, stories began to pop up one at a time. People on our own team that had a son that had battled addiction, that lost a cousin. If you can impact healing, you don't save just one person, you save a family. It's the patient's spouse, it's the patient's children, and that impacts all of us.
We've been able to affect a lot of lives in a very positive way. Our numbers have showed that over and over again. And we're taking this opportunity to not only help these people, but really change a culture and affect a community. And I think we're definitely on the verge of doing that.
At the end of the day, this project was not about growth of margin or volume, but it's truly about changing a mindset and changing a culture and really reaching the mission of HCA, which is above all else, we're committed to the care and improvement of human life.